Good morning, everybody. Dr. Price here. On today's video, I had a patient ask me a question about what's actually happening in the body when we're doing non-surgical spinal decompression on the low back and on the lumbar discs. So I want to draw a diagram real quick and explain to you what actually happens. So in your low back, we have a bone, a disc, and a bone. This is a joint spinal segment. This disc is what we're dealing with because at some point this disc has started bulging out and occluding this area right here. That means closing off that area and affecting the nerves coming out of the low back. So what happens is in non-surgical spinal decompression, the patient is laying down. So we have a force pulling towards the head. It's actually not a force going towards the head, but it's the body is laid down, so the body is anchored in the top. And then we have a force pulling towards the feet. These are the feet, and this is the head. Now, when that happens, what happens is these joints, this bone will actually separate. Now, the difference between decompression and traction is that decompression actually works through the muscles, so the muscles won't be guarding and won't splint the joint, and will actually allow the decompression to take effect into the joint. So whenever you spread this and these bones go further apart, theoretically what we're doing is we're creating a negative vacuum effect in here. So what we're hoping for is that disc material will actually be kind of sucked in. So through a series of treatments, we can actually start sucking this disc material and sucking these bulges into the spine, or back into the midline. So that's one way that we actually take the pressure off the nerves inside the body. Now the other thing is, if you have that disc and then you turn it to where you're looking straight down at it, this is what you would see. You would see the inside of the disc, and then you'd see it surrounded by a bunch of rings. Now, when a disc gets weak and starts to bulge, that's because these rings start to get weak and this disc material starts to leak out and eventually comes out here and causes that bulging in the disc. So another aspect is when the decompression happens and it starts causing that negative vacuum effect, these fibers will actually start to separate to allow that material to seep through. And what will happen is when we do the decompression, we get the negative vacuum effect. This bulge hopefully will be sucked back in, and these fibers will actually come back in contact with each other. And when they come back in contact with each other, the body has type 2 collagen fibers that can come in and actually try to heal those connections. So we're actually trying to heal the disc as well as getting the decompressive effect and getting the disc bulge in. Now, does that happen in every case? No, it does not. That's the best case scenario. We're looking for that healing process to occur. But there are about 70% of the population that are walking around symptom-free with herniated discs. So even if this doesn't happen, the extremely high success rate for decompression, in my opinion, comes from the fact that we're getting enough of the pressure off of the nerve to desensitize that nerve to where it's not causing acute symptoms. And this can be a long-term fix. Sometimes some patients need maintenance with it. Definitely you need chiropractic care to maintain the results. But you know, for the most part, this can be a long-term fix for a lot of patients that suffer from chronic back pain. So I hope that explains it. As always, my hope for you is that we take control of our take control of our health before our health takes control of us. And I'll see you guys tomorrow. Enjoy part 4 of the antidepressant video.